Good morning.
Is it possible to be two places at once? For patients and physicians of St. Joseph Health System, the answer is now yes. The InTouch robot remote presence allows physicians and specialists to provide consultations and evaluations from locations around the state. Patients in smaller communities receive the benefit of access to doctors and specialties that might not be available at their hospital. From miles away, physicians can navigate the robots to provide bedside exams and evaluations using the robot's computer screens with real-time video cameras for eyes and built-in microphones for ears.
Here's our plan for tomorrow. Tomorrow morning I'll see you somewhere before I start my OR day, sometime before 7 a.m.
A robot is placed in each of St. Joseph Health System's facilities. Although not meant to replace our employees in their compassionate bedside manner that only humans can provide, the robots extend the delivery of care to improve access to the highest levels of healthcare at all our facilities. One of the vital patient care areas that has been successful is the Teleneurology Consult Service, which connects outstanding neurology consultants throughout the state to patients at St. Joseph Martin, St. Joseph Berea, and St. Joseph Hospital.
My name is Dr. Alam Khan, and I'm a general neurologist. I've been practicing in this area for about 10 years almost. August will be my 10th year. I think this was a common reaction to every doctor when they when they think about how they're going to see the patient through a robot. But after introduction to seeing it myself, it did make a difference, you know. Seeing is believing, I think. What has happened is these outreach hospitals we have, they do not have neurology coverage. We do not claim that we are the treating physicians at that time. We basically say we are the consulting physician and helping your primary doctor who's there to help you through it. And through this, in fact, the control that you have in your hand like a joystick, you can focus the patient, their family members, they can see you too. So it is not just like a telephone talk, it is basically face-to-face discussion. And with the help of a nurse or a doctor on the bedside, we guide them through the examination and they know what to do. And for my own part of my exam, I can focus as far as I can go, even look in the pupils and eyes and mouth and tongue. If you are not a neurologist, you're going to auscultate the heart or something, you can do it through that too. The comfort that provides the family. So we're not out of touch when you're out of town. Unless you do it yourself, you see how it is being used, how the patient react to it, how the staff around them react to it, how the family members react to it. You know, it's basically, you are there almost. You are there.
Physicians including surgeons, pulmonologists, and hospitalists have been making supplemental rounds with patients via the InTouch robots. This allows patients to be seen earlier and more conveniently from a physician's office or home using a broadband connection, which has resulted in improved patient outcomes and, at times, earlier discharge. Clinical nurse specialists at the Diabetes Treatment Center at St. Joseph Hospital have been able to offer consultation and diabetes education sessions previously unavailable to rural patients in Berea, London, and Flagey. In partnership with Jewish Hospital and St. Mary's Healthcare, St. Joseph is developing a Kentucky Stroke Network, which will provide 24/7 acute stroke consult services to all 7 St. Joseph Health System facilities via our InTouch robots. We anticipate that 200 patients will receive care who would otherwise have required transfer outside of our facilities. An expansion of our telesleep program is also planned with use of our robots in Mount Sterling and Martin.
It's not benefit to the doctor itself directly. It's all basically talk about the patient, you know, how we can provide the best care possible.
We should be able to provide sleep diagnostic care for over 250 patients in rural counties as a result.
And I think it can go global too. It will, and the future is there that it's gonna go global. And maybe I'm sitting back in 10,000 miles out of Far East somewhere, and I can access through the fast internet and talk to the patient's family here. And so that's why I keep that computer in my car majority of the time.
It makes me feel comfortable, like should I have a problem after hours, late at night, that they could call the doctor and he could just, you know, look in on me. He could speak with me and find out how I'm feeling, what's going wrong. He can do close-up examinations of me. He just has to have the nurse's hands, and it does make you feel comfortable that he's available.
Guided by compassionate hearts, the InTouch robots provide the tools, movement, eyes, ears, and communication. Wherever they are located, our award-winning healthcare providers can provide outstanding patient care to a growing number of people throughout the St. Joseph Health System.
All right. Well, I'll see you later.
All right, bye.